welcome back to my channel. Today I'm going to start a very important topic of Toronto Notes 2025 edition, and this is the family medicine chapter. And definitely this is one of very high yield chapter because in Q1 many questions come from this portion of medicine called the family medicine. Okay, so let's take a start. Basically, we need to learn that there are four principles of family medicine being practiced here in Canada. The first thing is the family physician, the College of Family Physicians of Canada, they tell us that the family physician is basically a skilled clinician. He has lots of skill and knowledge, and he's also known as a general practitioner in Canada. He works with patients to understand their illness experience and collaborate on shared management plan. He takes history examination and brings up a management plan for a person and uses expert journalist knowledge to develop a comprehensive approach to the management of undifferentiated diseases, multi-morbidity and chronic diseases. So, I need to give you an idea about the role of general practitioner in Canada. Almost all the families, either newcomers, either old, they have a specific general physician or general practitioner allotted to that family, and he is responsible for taking care of all the household members. And if any person, any individual is suffering from any illness, either chronic illness, either acute illness, he is supposed to treat them. He is supposed to do the record maintenance. He is supposed to arrange the follow up, the labs investigations. So whenever we have a visit with the family physician, he is supposed to take history, complete examination, investigations, write up a management plan, and especially follow up is a crucial part of all this. And Also record maintenance and also very important thing is that the family physician also basically they will motivate the people to have annual checkups and periodic health assessments as well if needed. Okay, now the family medicine is a community based discipline. Just remember, it is a community based discipline. It responds to changing needs and circumstances of the community. Of course, all the members of community, they can be treated under this discipline. Emphasis especially on injury or disease prevention and health promotion. So basically, it not only a family physician not only helps in treatment of diseases or conditions, it also helps in injury prevention and disease prevention and health promotion as well. So prevention and promotion is also a role of disease prevention and health promotion. Both these things is also the role of family physician. Okay, now sees patients across their lifespan. That's why I told you that a whole family, household members means including the father, the mother, the children, and even the grandparents. They are supposed to go to the same family physician throughout their life when they present with a variety of diseases in a variety of clinical contexts, collaborating with a network of multidisciplinary community health care providers. Okay, and the important thing is that if someone is suffering from any condition that needs to have a specialist review, so the family physician is going to refer that person. For example, someone is suffering from a skin condition and he needs to see a dermatologist. So what family physician is going to do? He is going to refer that person to the dermatologist. It's his domain that he can refer the people to the appropriate specialist. Okay. Okay, skilled at dealing with ambiguity and uncertainty, of course. Now, the third principle of family medicine in Canada is first was he should be a skilled expertise with good expertise. He's a skilled clinician. He's involved in the care of community based discipline, and family physician is a resource to a defined practice population. He engages in a self-directed lifelong learning to ensure relevance of practice in maintaining patient health, advocates for public policy that promotes health, resource stewardship, and the continuity and coordination of care. So basically, in short term, He is responsible for health promotion, disease prevention, and he is that's why he is involved in lifelong learning. He need to update his knowledge and skills accordingly, according to the needs of the community. Okay, now the patient physician relationship is central to the role of family physician. He commits to the whole person, not just the disease. That's why I told you that he is supposed to keep the maintenance of the record. Like if someone visits him and in the next visit, he definitely has a record what was the presenting complaint in the last visit and how it evolved now, what is the presenting complaint right now, and he is committed to the whole person as a whole, not just the disease. In the context of patient's family, that's why he also keeps an eye on the patient's socio-economic status. Okay, and if the patients need any help in buying medication, definitely he provide them the resources, he provide them the basically drug plans and those things, yeah, knowledge and information about those things. And also he keeps an eye on the social environment, socio-economic status of the patients. Okay, he promotes continuity of patient care, respecting patient privacy and the physician patient relationship. Privacy, confidentiality is definitely a very important pillar of medicine practice in Canada, and he keeps the privacy of all the patients under his care, and that's why he is responsible for all these things. Okay, now experts in journalism. Journalism is a professional philosophy of care distinguished by a commitment to holistic, integrated, person centered care. So basically, in Canada, it's not a physician centered care, it's a patient focused care, patient centered care. Patient is the vital, I should say, is a vital organ in basically disease management. So a physician cannot implement his things on the patient. He has to take consent all the time, he has to provide them with all the available resources, and it's a patient choice how they are going to deal with that situation. Okay, so it's a patient focused care, patient centered care is a patient care centered model being practiced in Canada, and he collaborates with the larger healthcare team in order to respond to patient and community health needs. Family physicians are the experts in journalism with an emphasis on patient and patient's care and the family-centered care, community adaptiveness and undifferentiated problems, management of uncertainty, prevention and health promotion. So this is just for our knowledge that he has to treat patients as a whole. Okay, he is going to provide the patient focused care, and he helps in management of and prevention and promotion of health and prevention of diseases and health promotion, multi morbidity, chronic diseases, and health and illness. Okay, now the next thing I'm going to read is periodic health examination. Definitely it's under the jurisdiction of family physician to ask the patients and their families for periodic health assessment, periodic health examination. The Canadian Task Force on Preventive Healthcare was developed to develop and disseminate clinical practice guidelines for primary care and preventive care. In Canada, the prevention is always recommended that prevention is always better than cure. So diseases that can be prevented, definitely they take all the measures for prevention of diseases. Okay, and they provide recommendations based on systemic analysis of evidence and periodic preventive health visits. So basically, periodic health visit examination, the basic purpose is prevention of disease. Okay, when there is a periodic checkup, so they are going to do some screening, they are going to do some prevention. So basically the purpose is prevention. Okay, I'm going to write it for you guys so do you remember that periodic health assessment, the basic purpose is prevention of diseases. Okay, and so periodic is basically preferred as compared to the annual physical examination, sometimes called yearly physical. So it's now it's highly recommended that periodically on and off assessment should be done on the patient so that diseases can be prevented instead of just one annual checkup and that's it. Now, adult periodic health examination, male and female, evidence based preventive care Basically checklist forms. Okay, so we can see a checklist form what is going to be checked on periodic health examination. Okay, now the purpose of periodic health examination: primary prevention. As I already told you, prevention is the primary purpose of periodic health assessment. So this is basically prevention. Identify the risk factors for common diseases, consult patients on health promoting practices. For example, vaccination. Okay, we have to identify risk factors for common diseases, consult patients, and vaccination. And what is secondary prevention? Secondary prevention is early detection of disease to allow prompt treatment and prevent disease progression. Okay, so the purpose is basically first thing is primary prevention. We have to identify the risk factors for disease, consult patients on health promoting practices like vaccination. So basically, the primary prevention is involving identifying risk factors for common disease. We have to identify those risk factors. We have to consult the patients on health promoting practices. For example, vaccination. We have to identify the risk factors and we have to do promotion of health promoting practices like vaccination. Now the secondary prevention. What is secondary prevention? Secondary prevention means early detection of disease. We have to diagnose the disease in an early fashion to allow prompt treatment and prevent disease progression. So basically primary prevention is identification of risk factors and secondary prevention is detection of disease to allow prompt treatment and prevent disease progression. Again, primary prevention is identification of risk factors and like for example vaccination is a example of primary prevention, identification of risk factors and counsel on health promoting practices like vaccination. Now secondary prevention is early detection of disease, diagnosis of disease, and then treatment and then prevention of disease progression. Example of secondary prevention is screening, primary vaccination, okay, secondary screening. Now what happened next? Classification of recommendations or grade. Strength of recommendation: strong, confidence that desirable effects outweigh undesirable effects, or undesirable effects outweigh desirable effects. Okay, so what is that? Confidence that desirable effects, the effects that are desired, they outweigh undesirable effects. Strong recommendation, so it means the effects are very good. It's just highly recommended, strongly recommended. Okay, strong recommendation means highly recommended, strongly recommended, and the effects are very much desirable. Okay, and the undesirable effects are basically these are not highly recommended, not desirable, outweigh desirable effects. Strong recommendation against an intervention implies that most individuals will be best served by the recommended course of action. What is conditional? Conditional means desirable effects probably outweigh undesirable effects. So the desired effects that are needed, that are desired, they outweigh the undesirable effects. Okay. Now, or undesirable effects basically outweigh the desirable effects. Okay, implies that most people would want the recommended course of action but that many would not. Different choices will be appropriate for different individuals. Patients require support in reaching a management decision consistent with their values and preferences. Okay, most people basically they would want recommended course of action. Okay, then different choices will be appropriate for different individuals. Patients require support in reaching a management decision consistent with their values and preferences. Now the quality of evidence: high level of confidence. Okay, moderate level of confidence, low, very low. Not very important to remember. This is important to remember. What is that? periodic health examination, what we do for general population, what are we are going to do for specific population. This table seems important. MCQs can come from this table, okay? And it's a quite a big table. Let's look at it. Let's break it down into chunks so that we can easily remember it, okay? Also, clinical pearl is always important to read them if we find some valuable information over here. So, folic acid supplementation in pregnancy to prevent neural defects in all women capable of becoming pregnant in the reproductive age group. We give folic acid supplementation. There are low risk women, there are high risk women. Okay, so low risk women with there no health risk, planned pregnancy, and they are eating folate rich foods, daily oral multivitamin containing zero point 0.4 to 1 milligram folic acid for at least 3 months before conception, throughout pregnancy, and 4 to 6 weeks postpartum, or as long as breastfeeding continues. This is the total regime for low risk women. If they have no significant health factors risk, so zero point 0.5 to 1 mg, zero point 0.4, sorry, no 0.5, 0.4 to 1 mg folic acid is needed 3 months before conception, throughout the 9 months of pregnancy, and then further 4 to 6 weeks postpartum. Okay, now let's talk about the high risk women. High risk women are female partner with a personal neurotube defect history, a family history of neurotube defects, personal history of neurotube defects, previous neurotube defect pregnancy, or male partner with a personal neurotube defect history, a previous neurotube defect pregnancy, diet of folate rich foods, and daily supplementation with multivitamins with 5 milligram. Now look at the increased quantity. MCQ comes because this is a high risk population, and this is something important. I'm giving it a star so that you remember that you need to focus on this clinical pearl. Okay, so for all the females, zero point 0.4 mg is good enough, but if this is a high risk woman, if 5 mg folic acid, that becomes good enough. Okay, and it should be started 3 months before conception until 12 week post conception. So after 12 weeks, within first 12 weeks, that is good enough. Okay, and from week 12 post conception until the postpartum period, 4 to 6 weeks, or as long as breastfeeding continue upon. Okay, so first 12 weeks of pregnancy starting before conception, 3 months before conception, to first 12 weeks, that is roughly 3 months after the after conception, or when the patient gets pregnant, when the female gets pregnant, we have to give 5 milligram of folic acid. After that, from the week 12 until after delivery, 4 to 6 weeks, or as long as breastfeeding continues, 4 to 6 weeks after delivery, 4 to 6 weeks after delivery, or as long as breastfeeding continues, zero point 0.4 to 1 milligram of folic acid supplementation is just sufficient. How much is sufficient? 0 0.4 to 1 milligram of folic acid supplementation is sufficient. Women with additional lifestyle issues like poor compliance with medications, no consistent birth control, taking possible teratogenic substances. Okay, now the women will have some additional lifestyle issues like they are not compliant with taking medications, they have no consistent birth control methods, taking possible teratogenic substances that are basically harmful to the fetus, higher folic acid dose of 5 mg, and counseling about prevention of birth defects is needed. Okay, if they don't take the medicines, or if they are exposed to teratogenic substances, a higher 5 mg dose is needed, and also counseling is needed about prevention of birth defects. Now let's talk about the periodic health examination, general population. Dental hygiene, we need to check for the general population. We do fluoridation program. We have to provide a fluoride toothpaste for the little children, and then brushing and flossing and noise control and hearing protection for ears. So dental hygiene, ear protection, screening for poverty, constant on smoking cessation and nicotine replacement therapy, referral to the smoke. So it is basically the responsibility of family physician that if a patient is willing to stop smoking, he has to definitely help that person and send him to the smoking cessation program. Dietary advice on leafy green vegetables and fruits. Okay, also we have to ask them about dietary habits and then advice and seatbelt use, moderate physical activity, then avoid sun exposure, where what protective clothing we don't have to exposure to sun is also should be limited, and problem drinking screening and counseling, so lots of alcohol drinking not recommended, and counseling to protect against STIs, nutritional counseling, lots of counseling is involved, dietary advice on fat and cholesterol, and dietary advices on calcium and vitamin D. So basically, dietary advices on fat and cholesterol, and dietary advices on calcium and vitamin D. Okay. Now, physical, we have to check the blood pressure of the blood pressure measurement means of the population. We have to do regular checkup of blood pressure using techniques described in check guidelines. We have to measure height, weight, and BMI. So basically, blood pressure on every visit along with height, weight, and BMI also very important. Now the specific population, what we are going to check for pediatrics. Home visits are for high risk families. Home visits are even needed. Injury prevention, we have to protect the child from all sorts of injuries. Injury prevention like poison control or smoke detectors, non-flammable sleepwear. Okay, we have doctor advised the patient that if you have little children in your home, you should use smoke detectors at home. Okay, and the hot water thermostat settings. Okay, inquiry into developmental milestones, and also check about the milestones of the newborn is developing well or not, or what happened next. Then what is adolescence? For adolescents, counsel on sexual activity, because in adolescence age they started having sexual activity, and contraceptive methods. And then we are talking about the methods of contraception. Definitely, we are going to basically help them. Okay, and the council after looking at the capacity of such individuals and taking informed consent from these individuals, we have to offer them contraception. Counsel to prevent smoking initiation and substance use. Okay, and then perimenopausal women, that the age group is more than 50. Okay, perimenopausal more than 50 assess for risk factors for osteoporosis. Okay, okay, because of bone mineral density is decreased and fracture risk is increased. Counsel on osteoporosis, counsel on is a benefit of HRT. HRT is basically meant for hormone replacement therapy, hormone replacement therapy. Okay. Okay. Then the next thing is adults age more than 65. A follow up on caregiver concern of cognitive impairment recently post falls. So basically, adults who are age more than 65, we have to follow up on the caregiver, because the caregiver assessment is also needed, and multidisciplinary post fall. If there is any fall, we are take it very seriously in elderly. Now pediatrics, repeated examination of hips, eyes, and hearing. Okay, serial height, weight, and head circumference, and visual acuity testing. After it, we have to check for the vision. We have to check height, weight, BMI, head circumference, and basically hips, eyes, and all these things. And yeah, adults age more than 65, hearing impairment. Okay, we are going to check for the hearing impairment, inquiry, whispered voice test, audioscopy. Okay, whispered voice test. Okay, and audioscopy. Next thing. Okay, next thing is that if first degree relative with melanoma, we have to do full body examination. Next thing is continuing with general population tests. What tests are needed? Periodic health examination. See recommendation below for age and gender for screening for diabetes, dyslipidemia, hypertension, cancer screening even. One time screening ultrasound for abdominal aortic aneurysm A65 to screening is basically done at various levels, and screening for colon And prostate, cervical, lung, and breast is highly recommended. So there are five organs that can be screened: colon cancer screening can be done, prostate cancer screening, cervical cancer screening, cervical cancer screening, yeah, and lung and breast. Okay. Now, therapy. Folic acid supplementation for women of childbearing age. Okay. Pharmacological treatment of hypertension. Pharmacological treatment of hypertension, varicella vaccine for children aged 1 to 12. Rubella vaccine, all non-pregnant women of childbearing age unless there's proof of immunity. Okay, tetanus vaccine, booster every 10 year one if had primary series. Okay, high quality of evidence. Primary series, high quality of evidence. Okay. Okay, there are seventh as folic acid needed for all the women of childbearing age, already know. And hypertension treatment needed to be done with varicella vaccine for age 1 to 12. Rubella should be given to non-pregnant women. Then tetanus vaccine booster is given every 10 year if had a high quality of evidence. And pertussis vaccine adults should receive one booster given a 3 dab of boostrix, high quality of evidence. And herpes zoster vaccine again after high quality of evidence. Okay, now special population pediatric routine hemoglobin for high risk infants, blood lead screening. Okay, hemoglobin check, lead level check, TB high risk Manto. So what test is basically done for screening of TB? Manto skin test. STI high risk group voluntary HIV antibody screening. HIV antibody screening, gonorrhea, chlamydia, and syphilis. Okay, STI screening include basically testing for chlamydia, gonorrhea, HIV, gonorrhea, chlamydia, and syphilis. Okay, then syphilis high risk groups VDRL, syphilis high risk group basically VDRL pediatrics routine immunizations. Okay, then routine immunization after influenza high risk groups. Outreach strategies for vaccination. Annual immunization now recommended for all. Okay, now influenza high risk groups in outreach strategies for vaccination. Annual immunization now recommended for all. HPV high risk group vaccination for major with no upper limit. Immunocompromised sacrifice COPD, asthma, pneumococcal vaccine is recommended. Okay, I think so. Also, HPV high risk groups vaccination for males and females from age 9, and TB high risk group isoniazid prophylaxis for household contacts. Okay, isoniazid prophylaxis for high risk groups. Immunocompromised and pneumococcal vaccine is given for all patients more than 65 years. So all these are basically measures for prevention of disease, like some vaccines are given or some prophylactic drugs are given so that the disease cannot be spread. Okay. Okay, and the other thing is like breast cancer screening guidelines. Okay. Okay, I'm going to sign off for now. I'm going to cover the screening guidelines in my next video. And thank you so much for being with me. And today was my first session on family medicine, and hope to see you soon with our next session on family medicine starting from page 4. Thank you so much. Have a good day. Take care. Bye.